The next thing we're going to discuss is treatment for pain in the bottom of the foot, typically in the padding of the foot. There's a couple areas that you can have that pain. One is underneath the great toe joint, usually associated with a bunion deformity or a condition called sesamoiditis, which is an inflammation of the bone there. And there's also people that have pain underneath the metatarsals, which is called metatarsalgia, which is generalized pain to the bottom of the foot. There's two pads. The one for the pain here, or sesamoiditis, is called a sesamoid pad. This little guy has a special little aperture in it designed for problems like this. So you can see it has a little pad. There's always two in a pack. It is important. You can come in. It is important which if it's right or left, because this thing actually has a little adhesive sticky in the back of that. You can peel that back and stick it directly on the foot. Patients at home, as they use this, they're going to lose some of that stickiness. They'll just take some soap and water and clean that, and it'll come back once it's dry. But what's really important that we do, if you don't mind moving that for me just so I can see this, is this little pad is going to go right where they feel their pain in the bottom of their big toe joint. So, for example, the best way to apply this is to basically find where it hurts for the patient underneath that joint. When you find where it hurts, take this little guy and stick it right around your thumb. And that way when they walk, it'll relieve the pressure there. Another treatment, if someone has just generalized pain over their whole foot, or they have a neuromal, which is a pinched nerve in the front of their foot, joint pain, or just generalized pain in those bones, which is often caused by loss of fat padding there. What we'd be using then is one of these Dr. Jill's ball of foot gel cushion. I want you to notice that in their advertisement, they actually place it in the incorrect spot. They're using it like a pad underneath the bones. It's just the opposite. Just like that one is designed for the taking pressure off of the bone here, this is designed to do the very same thing. So most people that are going to have pain in the front of their foot, they're going to have it directly underneath the weight-bearing surface. So they're going to have it right underneath these bones. What you don't want to do after you take off this little thing to allow it to stick is you don't want to put it directly underneath that spot. That will actually increase pressure and create more pain. What you're going to do is apply it right in that little pocket behind those bones. So basically what that does is when they walk, it lifts the pressure off that spot and alleviates some of those symptoms. And that is the ball of foot cushion and the gel dancer's pad for plantar foot pain.